Well, good morning, everyone. Thanks for joining us this morning for our Sioux Falls media briefing. We're here today to give you an update about the link and introduce a new face to the link as well. So I'm Mayor Paul Tenhaken. The link was opened in 2021, so we're going on 5 years that the link has been open, almost 5 years. And initially we called the link the Triage Center, and triage meaning place where we triage, and a lot of people don't know what triage means, so we called it the link, a place where we link people who are in need of services in our community to our partners. So those experiencing behavioral health challenges, but more importantly, what we're seeing a lot of is obviously substance abuse disorders, to those who need immediate treatment and referrals to support services. So we have a lot of great organizations in this community that provide addiction treatment services, and the link is kind of the first stop where we take people that are experiencing those challenges with addiction and provide them an option. And they have an opportunity to be linked to a place where they can receive other services. Sometimes they take us up on that, sometimes they don't. But it's been a home run for all intents and purposes, as you'll see with some of the data here in a little bit. Some of the specific services we offer there, we offer medically monitored withdrawal management. We offer observation for intoxicated individuals in our community. We offer crisis stabilization for people that are experiencing crisis challenges. It's created and funded. The link was created and funded in a collaboration with 4 primary partners. That was the City of Sioux Falls, Minnehaha County, Avera Health, and Sanford Health. So those were the 4 primary partners that came together and formed the link about 5 years ago. We also had really early funding support by a variety of entities, and I was thinking how the timing of this, but Smithfield Foods was an organization that really early on stepped up and gave us a large grant early on to help with the build out of that facility. And the Helmsley Foundation was a large partner early on, and Greg and Pam Sands, who have been real loyal, a loyal family in this work for many, many years, have been a supporter. Lloyd Companies was a partner in this early on, so we've had great community support for the link as well. So the link really seeks to provide innovative approaches to address gaps in critical services for people that are living with those mental health and substance abuse challenges. And we've really seen those increase over the years. They've increased post-COVID. They've increased as our community has grown. As the community grows, so does the people who experience addiction challenges. When we grow by 5,000 to 6,000 people a year, it's only a given that we'll have people who are experiencing addiction needs as well in our community. It's really designed to, like I said, meet individuals and connect them to appropriate services. And in 2025, it was another year where our numbers that we served, they increased. And I'm going to get into the numbers here in a minute with our new project director. But we realized this last year that we needed to bring on a project director to help lead some long-term funding strategies and to help us restructure the board of directors. So to date, the board of directors has been one member of each of those 4 funding partners, Sanford, Avera, the county, and the city, and then an at-large member, which has been a member of the Helmsley Charitable Trust organization. We're at the point now where that board really needs to function more at an operational level, really help the link in some of the operational challenges and opportunities, and less of us kind of bureaucrats like me who don't know a lot about behavioral health and addiction issues. We were the right people to help get it off the ground, and so we're looking at how do we restructure the board to be a board that can provide better insight and better help to the link staff and to our partners at Avera. And so we brought on Jason Lemke in December of 2025 to a 12-month contract position to serve that role as what we're calling a project director. He has 25 years of experience in community partnerships and fundraising, in organizational development, in administration and management. So really a great fit in a lot of nonprofit space to work with us in the link in this role, and you're going to hear from Jason here in a little bit. But before you do, I want to talk about that financial piece and the long-term financial stabilization of the link. So one of my goals is to try and get the link on some solid financial ground before I leave in office in 148 days is what the clock said on my desk today. This right now is what the link looks like from a financial standpoint. So those are your four primary funding partners on the screen. You see Sanford, Avera, the city, and the county. And you see our contributions. You also see how in 2026 there was an increase also from the city and the county as we're able to put some more of our opioid settlement dollars towards the operational costs of the link. Despite that, we still operate at a loss because the operating cost of the link is around that $2.5 million mark. So we operate in the red. And so we use either grants that we try and get, we're eating up some reserves, other contributions. So we have a slow kind of burn down of cash and capital at the link right now. And so one thing that we're very hopeful on is some of the state opioid dollars that we know are available. We have a grant out there that we know is being reviewed by the state, and so we're optimistic that we'll be someone that receives funding for that because of the critical work that we're doing here in Sioux Falls. We're not just serving people in Sioux Falls, we're serving people across the state that end up in Sioux Falls that are dealing with addiction challenges. And so we know our partners at the state understand that, and so that chart right there is something that I am taking ownership of and really going to be working on before I'm done in office and trying to close that delta. But I just wanted to be very transparent with the public that the link is not a cash cow. The link is not something that Avera has taken off from a contract standpoint to make a lot of money either. They about break even operating this thing. Staffing is very challenging. A place like the link, I think we probably have 2 or 3 traveling nurses right now that are staffing over there because getting staff from a nursing standpoint is challenging. And so it's a difficult place. It's a difficult place to run. And so we're very thankful for our partners at Avera that have the contract to run that place year to year. We're very thankful for Sanford Health and for the county and the city. We recently got a gift from Greg and Pam Sands, a 5-year gift, $50,000 a year to help us close that delta. And so a lot of people don't think of the link, I don't think, as a charitable contribution place where they can give dollars, but you can see we're running at a $700,000 gap every year. So if anyone out there is saying, hey, I wonder where there's a community need right now in the addiction space, come talk to me, because we know a place where you can put that money to use. So with that, I'd like to introduce Jason. Jason's going to talk a little bit about some of the numbers we've seen at the link and a little bit about his role as a project director for the link. So Jason Lemke.
Thank you, Mr. Mayor, and good morning, everybody. As the mayor said, I'm Jason Lemke. I'm a South Dakota native, lifelong South Dakotan, with about a quarter of a century now. I don't like saying it that way; it makes me feel old. But about a quarter of a century in the higher education and nonprofit spaces here in the state. And my role at the link, as he said, is to come in and look for some strategies for some long-term funding additions to help come alongside our existing partner contributions, stabilize the link long-term so that these important services are here for years to come in the community for those who need it. In the early weeks of this role, I've been taking a lot of meetings, having a lot of conversations with stakeholders from all parts of the community, and just trying to learn what the link has meant for them and their organizations, where the link has succeeded, where there are gaps still that the link may be able to grow into the future as we look at the next 5 years of the link. starting in June of this year. So before I dive into too many of the service numbers, I do want to touch on a couple of things as far as how people come to the link, how people arrive at the link. About 40% of our folks arrive via law enforcement right now, and that's been a great partnership that has been, I think, positive both directions. It's been a win-win for law enforcement and for us at the link. 30% of our patients are walk-ins. They walk in off the street on their own. Another 19% come from Avera security transport. So folks will present at an Avera facility, and once they are assessed, it will be deemed that they are more appropriate to be served at the link with the services that we have here, and so they will transport them over to the link so that they can access our services. These arrival numbers, I think, demonstrate a couple of things. Number one, I think the location is exactly where it should be. The central location right here in downtown is accessible for a lot of the population to walk up and access services whenever they need them. And that also provides good access for our law enforcement partners. So 2025, as the mayor said, I came on in December, so I'm looking backwards at some numbers that I wasn't in the building for, but they're still very informative, I think. We served at the link in 2025 3,630 individuals, which was an increase of 258 from the prior year. That brings the total to 16,751 since the facility opened in 2021. And we're not far away at this point, I think, from crossing over that 17,000 mark already in 2026. The link was designed not to be a destination for these folks, but to be a starting point, an entry door, if you will, to that path to stabilization and ultimately recovery from whatever it is that they are battling against. It is not a long-term housing solution. It's not a long-term mental health treatment solution. It is triage and connection to those long-term services if that is what they need. The link fills an important gap in the community and in the continuity of care, the continuum of care for these individuals that we're seeing come through our doors. More than 2,000 of that 3,630 that I mentioned, more than 2,000 of those individuals indicated to us that they would not have sought help elsewhere if the link was not available. So that's an important piece of information for us that lets us know that we are standing in a gap, and that if the link wasn't here, there would be a massive impact on those individuals and ultimately on the community. We had 689 referrals from our local emergency departments. That represents about a $700,000 cost savings and also freed up beds for more critical access patients. 943 individuals were diverted from jail bookings in the past year, reducing a strain on our jail over at the county. Also representing about a $250,000 cost savings to the community. The graphic that you see now shows that dramatic decrease in jail bookings. And this graphic starts at 2017, and you can see the sharp drop-off there between 2020 and 2021. The middle of that gap between 2020 and 2021 is when the link opened. So you can see a pretty stark and direct correlation there between the number of jail bookings for protective custody, for involuntary commitment for drugs and alcohol, or for emergency 5-day holds. And those are the three booking categories that are primarily being diverted to the link at this point. So, so the savings over there are pretty dramatic and pretty easy to see. Our friends at Southeastern Behavioral Health have been great partners as well. They are the community's designated mental health center, and they partner with the link in conducting substance use and mental health assessments for individuals who seek help at the facility. They have also helped in providing some wraparound services, helping get people linked to long-term medication management and housing options if that is what they need. In 2025, Southeastern Behavioral Health completed hundreds of assessments within the link and referred 157 people from the link to inpatient treatment care. If you break that down, that's about 13 people a month, and that's not a bad return on investment when you think about those lives that are being helped and potentially saved by getting these folks into inpatient treatment. 70% of our population at the link that we serve are unhoused or unsheltered. The link is critical in supporting these individuals within the community and being part of a network of services that the city and the county are trying to provide to help make sure that these folks don't fall through the cracks and that they have access to all of these services that they so desperately need. The link overall is here to promote hope and healing for anybody who is experiencing a crisis in substance use or mental health. And we are trying to meet each person where they are in their journey. Those of you who have been touched by substance use or mental health issues in your own life or in your family's lives, loved ones, you know that these are complex issues that don't have simple solutions, and that it often takes time and multiple attempts before you can address the underlying symptoms and the underlying causes of these issues. So we at the Link, we're here without judgment, and we're here to meet people where they are and offer them, I like to think of it as exits on the interstate. We offer them an off-ramp. It's up to them if they take it, and if they take it, it's up to them if they decide to stop and park on that off-ramp or if they decide to get back on and drive some more. Our job is to stand here, offer them the off-ramp, and when they take it, to wrap as many services as possible around them and embrace them where they are and where they need to be at that moment. The Link is here to be a secure and trusted partner in the community. We recently received our third accreditation from the Commission on Accreditation of Rehabilitation Facilities, or CARF. The surveyors praised the engagement from the community partners and the unique partnership of the city, the county, law enforcement, Southeastern, and the local healthcare entities. The Link is located, for those who don't know, at 8th Street and Dakota Avenue, just north of City Hall. Walk-ins are welcome, regardless of insurance status or income status. If you want to come access our services, we would love to see you. Come take advantage of us. We're open 24/7. If anybody wants additional information on the Link, you can call 605-275-1000 or visit linksf.org. And with that, we'll open it up to questions.
Can you talk a little bit more about the expenses at the Link? I imagine, staffing is probably a big part of that, but like what goes into that, what was it, $2.5 million a year number?
So yes, the largest portion of the expenses at the Link is staffing. The services that we provide at the Link are the mission. It's one of those nonprofit environments where the service is the mission. Nonprofit entities, nonprofit organizations, a lot of times are questioned about overhead rates. But when you have a service like the Link provides, overhead is very, very small because all of the clinical staff, all of the intake staff, all the mental health workers that are in the facility that represent the vast majority of that 2.5 million a year, those aren't overhead, those are mission, and those are impact positions. So, but yes, the bulk of that is direct services to the patients.
I'm also curious if I can ask a follow-up just on how has Medicaid expansion helped at all, or is the unhoused population maybe not signed up for Medicaid? Like, do you have resources to help find like insurance? Is that playing a role in offsetting costs at all?
So Southeastern, in some of their wraparound care that they've been providing since they've partnered with us, has done a lot of great work in getting folks signed up for Medicare if they are eligible and they are not already signed up. As far as Medicare expansion offering assistance, Medicaid isn't super friendly to substance use treatment. There's not a lot of billing opportunities with Medicaid for substance abuse treatment. So when it is possible, it is taken advantage of and billed. And if an individual comes in who does happen to have private insurance, that private insurance will be billed as well. But the reality is that most of these folks don't have insurance and don't have means to pay. And then we provide the services regardless.
I have two questions. The first one is when it comes to the partnership with law enforcement, when they bring people to the link, how often do you see those people still willing to get treatment, or when they're brought, they're still resistant and maybe they'll stay for a few days for treatment but then leave and not come back?
So I think probably the most honest answer to that is it varies dramatically by individual. Each person who comes in, whether they come with law enforcement, whether they come on their own, whether they come in a private car brought by a family member, each person is at a different point in their journey. I can say that in general, arriving at a facility like the Link rather than arriving at jail and being booked in, you are going to get a higher rate of willingness to engage in treatment in an environment like this, which is one of the reasons that it's important to have facilities like the Link in a community, excuse me, rather than trying to detox people in a jail setting. And what was the second part of your question? Sorry.
With the recent announcement of NAMI South Dakota dissolving last week, do you think the Link is going to become an even bigger resource for people, even though it's located just in Sioux Falls? As you said, people can still come here that aren't in the city.
Yes, definitely. I think with NAMI shutting their doors in South Dakota, anybody working in the mental health and crisis management field is going to become more critical in their communities and in the state. So yes, that's definitely, and I took notice of that when I saw that come out, because it's gonna impact our planning going forward, and it's gonna impact, I think, the traffic that we see.
Thank you.
With this change in structure, you've talked about needing to change to get the mayor out of this organization for a while. With the change in structure, how does that work? Will Sanford, Avera, and the county, will you still be on the board, or will it be completely revamped, or what's your vision for that?
Yeah, all those partners will still have board seats, just more applicable members of those organizations will be on the board. So instead of a Paul, think of a Michelle Treasure, Homeless Services Coordinator, who is deeper in this space on a day-to-day basis, maybe serving on the board, or Renee with the PD, someone like that, who's maybe living in this space and can provide more value. So we'll still all have board representation, just at a more applicable level.
So under Jason, there's a medical director, or is there still that level? Used to be the manager. I mean, how much is the structure at the facility changed?
It hasn't changed at all. We still have the contract with Avera. Jason oversees that contract. Julie and Natasha run the place, and I'd be remiss if I didn't point them out. They are incredible people. And so that structure hasn't changed at all. And so that won't change.
You've been doing this for 5 years now. You're leaving. Can you call it a success?
I will say this, the topic of homelessness has become much more of a topic than it was 5 years ago. And when people talk about homelessness, they want to talk about shelters, and they want to talk about housing, and they want to talk about panhandling and all those things. There's no greater investment that this community has made to help battle homelessness than that place. because he gave the numbers of the people who are unhoused that are going in there. And the percentage of people in our homeless community that are battling addiction is tremendous. And to not treat that root cause of addiction, which is preventing a lot of them from ever having a roof over their head because they can't they can't deal with their disease of addiction. We're spending $2.5 million every year trying to get them to cope with that challenge. And I don't think that place gets enough credit for those 17,000 people that they're seeing to try and get them out of that rut of addiction so that they can get a job, so they can get that cure for that disease that they're battling. So success, it's like it's a tension you'll always manage. So I don't think you ever say, we nailed it. It's a tension you will just constantly manage. And we will constantly manage it. I will say this, though, and we don't talk about it enough, but we have to acknowledge the fact that we are losing the war on addiction with our Native American community in this city. And no one wants to talk about it. If I can give you the numbers of what we see at the link, and you notice a funding partner, there's no Native American groups, organizations involved in this work. And we have to come face to face with the fact that a vast majority of who we're seeing at the link are Native Americans. And we have to confront this challenge because we continue to sweep it under the rug in our community. And so I'm calling on the state, I'm calling on the legislature, I'm calling on our tribes. What we've done to some of our Native brothers and sisters is not good. And it's tough. It's tough to see that. It's tough to see it when I'm driving in every day at 10th and Cliff. And so whether that's more appropriate care rooted in Native traditions, whether that's better relationship with our tribes to provide some of this care for them, I don't know what it is, but we have to continue to address that and work through that. Any other questions? All right. One more question?
Question about the around 17,000 number. Is that separate people, different people each time, or are those people that come back in like repeats?
I think that's aggregate triages, and I think the average person is seen at the link like 3 or 4 times. Correct? Is that is that right, Natasha?
4,700 unique individuals
All right.
in the last 5 years.
4,700 uniques, 17,000 total. So, yeah, it's about 3 visits per. Some we've seen hundreds of times. Some we've seen only 1 time. So it balances out. But.
Any other questions?
All right. Thank you for coming today. Thanks for your support of the link. Before we close, I also want to point out a couple other important people here. Renee Velasquez with our PD, a critical partner in this work. So Renee, thank you for that. Dr. Ron Place with Avera on our board, great partner in this as well. And of course, Michelle Treasure, our homeless services coordinator, great leader. And I pointed out the 2 chiefs in the back who helped run this place, Julie and Natasha, and then Thomas Otten, who is the man when it comes to behavioral health and addiction services in Sioux Falls. So thank you guys for all you do in this space. So thank you. Guys, have a blessed rest of your week.